Hi, everybody. We are going to start talking about the lymphatic system. So briefly, we're going to talk about some of the anatomy of the lymphatic system, including the vessels and the organs, and then we dive into how your body provides immunity against pathogens that can cause infection in our body. So let's go ahead and get started with looking at some of the common disease-causing agents in our body. So we can use, first of all, we can use the general terminology for that, which is known as pathogens. Now, pathogen could be the typical culprits, which are your bacteria and viruses, or it could be parasites or fungus. I'll have shown you in the pictures some of the common bacteria. These bacteria are identified as single-cell organisms. Some of them do contain a capsule that makes them harder to fight. They have the ability to stick to the surfaces like your teeth or your air passageways, etc., and they can cause disease if they can start to replicate, and our immune system cannot stop them. So the best way for our body to fight off bacteria is using white blood cells that are carrying a process called phagocytosis, which basically eat the bacteria and kind of break them down to little pieces. On the other hand, we have viruses. So viral infection is a little bit harder to treat typically in terms of medication. Viruses are identified as a bridge between living and non-living organisms. They are much smaller than a bacteria. They can replicate and take over a cell in your body and basically use that cell to make up their own components. And basically when they're done with that cell, they burst the cell open and they continue to infecting the neighboring cells. Now, a couple of things that you hear. One is about refrigeration. Can refrigeration actually kill bacteria? The answer is no. Typically, what you see is the cold environment slows down the growth of the bacteria, but the slowing down does not imply that they are killed. Best way to kill typical bacteria we found in our environment that can cause harm for us is by increasing the temperature, typically boiling your food or cooking your food at higher temperature. Does antibacterial cleaners really effective? Typically, we're gonna say no. There is no significant difference between washing your hands versus using the typical common antibacterial cleaners you can find in the market nowadays. Again, as you can see, a lot of the common procedures in terms of preventing our new threat, which is the coronavirus 19, is washing your hands rather than using a hand sanitizer, right? That whole 20-second washing your hands is a much more effective way of preventing the spread of the disease than using the hand sanitizer. Does hand sanitizer or cleaner helps? Yes, but they're also considered to be harmful in some cases, as they may lead to development of bacteria that are more resistant to our typical antibiotics. And can I use, a lot of time people say, can I use a hand sanitizer instead of washing my hand? The answer is no, you should still wash your hands. However, if your option is not washing your hands and using your hand sanitizer, then do use a hand sanitizer, especially the ones that have high alcohol content, which helps with removal of a lot of the pathogens from the environment. However, again, washing hands would be your primary means of fighting off any pathogen that may cause infection. Now, moving on in terms of lymphatic system. So lymphatic system is a network that is working network of vessels that work very closely with the cardiovascular system. What happens is that if you recall blood vessels, we have a category of blood vessels which are called capillaries. These capillaries were when you actually carry out the process of exchange. So you exchange your nutrients and gases between your blood vessels and your tissue. When these leaky networks basically are present in our body, some of the fluid from the blood leaks into the tissue, and your body, or more specifically the job of your lymphatic vessels, is to collect the leaked fluid from the capillary network, collect that leaked fluid from the tissue, and return it back into the cardiovascular system. They also, again, lymphatic system in general has the main function in terms of creating defense against any infective agents. And in a big picture, lymphatic system is broken down to lymphatic vessels and lymphatic organs. Now, let's take a look at this again. So lymphatic vessels, we start with the very smallest of these vessels, which are called lymphatic capillaries. We just talked about the fact that the blood capillaries, which you see in red and blue, are going to be your leaky blood vessels. And notice the environment around these. This is basically your tissue. So when the normal blood capillaries are leaking fluid into this tissue, into this environment, your lymphatic vessels or lymphatic capillaries, which are depicted in green, are going to pick that leak fluid. You can see them as these little black arrows, pick that leak fluid, and eventually return it back to the cardiovascular system. Now, the fluid that was leaked out of the blood vessels is not a full blood. It doesn't include typically your white blood cells, red blood cells, or proteins. It does contain a lot of the water and nutrients and oxygen and electrolytes. So the fluid that is basically gets picked up, which we identify as lymph, is going to be basically solutes and water, which is the nutrients, electrolytes, and oxygen. So anything that was small enough basically to leak out of the capillary network gets picked up by the lymphatic capillaries and move back to the cardiovascular system. One of the main things that I do want you guys to know about this lymphatic vessel, it is that it is one direction, as in it goes from the tissue, go back to the cardiovascular system. However, if you think about your cardiovascular system, if this is your heart, you start with the heart, you circle, and you come back to the heart. So it's a cycle. But if you're thinking about your lymphatic vessels, on the other hand, lymphatic vessels starts from the capillary network. So let's say you have a capillary network here, and then they go into the heart. So it is unidirectional versus a cycle that starts with the heart and goes back to the heart. Now, as we go through the lymphatic vessels, they become basically larger and larger. So the smaller one merge together to form a larger structure. And eventually, the largest structure within the lymphatic vessels is two main branches that are identified as thoracic duct and the right lymphatic duct. It is highlighted in the picture in dark green and light green what part of the body each of these duct system collects from. For instance, the thoracic duct, which is located on the right-hand side or depicted with the light green color, is the larger of the two. And you can basically see it picks up from all over your body with the exception of the right side of the head, right side of the neck, right shoulder, and right arm. So if I say right leg, the fluid from the right leg gets picked up by which of the two main lymphatic duct, then your answer should be thoracic duct. Just because it's on the right-hand side, it doesn't mean it's gonna go to the right lymphatic duct. So I tell my students, remember these, it makes it easier. So if you remember, the right lymphatic duct is the right arm, the right side of the head and neck and shoulder. Then if I give you any other parts of the body that is not one of the one listed, all of that gets drained into the much larger thoracic duct, which is again depicted in light green. Now, lymphatic organs. So there are two types or two categories of lymphatic organs. What we identify as primary and what we identify as secondary. Primary lymphatic vessels are going to be essential for the process of production and maturation of your white blood cells. Basically, the category of the white blood cells are the ones that are responsible for defense of the body against the infective agents. So the production and maturation of this category are associated with your primary lymphatic vessels, or sorry, primary lymphatic organs. Secondary lymphatic organs are responsible for a storage of these cells until these cells are needed by the body to fight off an infection. During that time, they can get activated and through activation start to proliferate or start to rapidly divide. And through that division and their activation, they can fight off any infection that your body will deal with. So let's go ahead and take a look at this idea of the white blood cells. First of all, when we talk about white blood cells, actually, let me change my color. When we're talking about white blood cells, there are two main categories that I'm going to focus on. These are known as B lymphocytes, and we sometimes just refer to them as B cells, versus T lymphocytes, which is also known as T cells. Now, if we're talking about white blood cells, the process they undergo is first they are going to be produced. Then they are undergoing what we identify as maturation, which basically means they are gaining the ability to identify an infective agent. And when that identification happens, they can trigger an immune response. Another sense, if I want to simplify it, that's their schooling. That's the part that teaches them what they need to do when they are placed in a situation. Now, if these mature cells are actually during the maturation, when they are completing the maturation, they're identified as mature but inactive. At this phase, what they are going to be, they're just going to be what? Placed in a storage. As in, we don't need you, you're not active, you're not really doing anything, just keep looking for a job, basically. Now, if they interact, so if they interact or identify, there is specific, here's the key word, there is specific pathogen, what they will become is they become what? Active, right? So up to this point, they were mature inactive. As soon as they do that, they become active. Through their activities, they undergo a process called proliferation, which basically, again, it starts to divide. And I'm sorry, my pen is not working very well. And through the division, they're going to basically target the infection. Well, that's infection, and basically destroy it. So one more time, reading through my handwriting, we start with production of the white blood cells, then you send them to school to mature. After they're done with their schooling, they are mature, but they're identified as inactive. They stay inactive until they meet their corresponding pathogen, which is highly specific to them. And when they do that, they become activated. They start to divide and make many, many copies of themselves through a process called proliferation. And after they make their own copies, they target the site of infection, the original cell that causes them to be active, and they destroy that infective agent. Please, please, guys, do note again, this is a highly specific immunity, as in you are not going to target any type of pathogen. You're not going to target a bacteria and viruses that enter your body. These cells, these white blood cells and white blood cells, either being B cells or T cells, they are very particular as far as what they fight off. As in, they have a very particular receptors on their surface, and that receptors must find its corresponding marker on the pathogen. And when that interaction happens, that interaction leads to the activation of these cells. So if you do not have that perfect interaction, if you do not have the specificity between your B cells and T cells, and the corresponding markers, which we call antigens, on the pathogen, if that interaction doesn't happen, then your cell will not be activated. Now, we're going to go into more details about them. I will spend some time specifically talking about the B cells and T cells in a very general sense. We also talk about the other parts of the immune system that is identified as non-specific versus what I'm describing here, which is highly specific. So let's start by the concept of production and maturation, which is the two first things these white blood cells need to undergo. So primary lymphatic organs, which we identified earlier and talked about this, they are responsible for what? For production and maturation, which is the first two steps. Secondary lymphatic organs are doing what? A storage of those mature white blood cells that are basically going to stay until they again meet their corresponding pathogen. So what is my primary lymphatic organs? My primary lymphatic organs are red bone marrow, which should sound really familiar since we already know that all of your blood cells come from your red bone marrow located inside the spongy bone. We also have, as primary lymphatic organs, you have your thymus, which you can see in this picture, located superior or on top of your heart. Secondary lymphatic organs include your tonsils, which we have talked about before. It includes your appendix. It includes something called Peyer's patches, lymphatic nodes, and a spleen. Now, localizing these structures, a spleen is located inside the abdominal cavity, farthest to the left, right next to your stomach. Peyer's patches are throughout the small intestine as literally little patches. Appendix is connected to the first part of your large intestine called the cecum. And we already talked about tonsils. Tonsils are localized around your mouth or your pharynx, as you can see in the picture. And lymph nodes, there are about 500 of them that are spread throughout the body. Now, again, we're going to start by talking about the primary lymphatic organs. The two primary lymphatic organs are your bone marrow and your thymus. So, what is the job of bone marrow? Bone marrow is responsible for production of both your B cells as well as your T cells. Again, you really don't care what is the white blood cell type. If they are white blood cells, the only place they're going to be produced is inside your bone marrow. Now, the second phase of this, after you produce them, basically you have a baby, now you decide if you're going to keep that baby at home and teach it what it needs to do, so mature it inside the home, or do you want to send it to a school outside to mature? So your B cells that were produced in the bone marrow are going to stay inside the bone marrow, right? They're going to be basically quote unquote homeschooled. So those cells are identified as B cell. Again, the B part of B cell comes from the fact that they are maturing inside the bone marrow. Now, T cells are born inside your bone marrow. They are produced inside the bone marrow. But for their education, they are sent outside to your thymus. So we call them thymus. They come from thymus, they mature inside the thymus. So we call them T cells. T stands for the fact that they're maturing inside the thymus. B cells is for the fact that they are maturing inside your bone marrow. But if I ask you guys, where does the T cells produced? They produce inside the bone marrow. If I ask you, where does the T cells mature? They mature inside the thymus. Typical location in a children is center of all of the bones contain bone marrow, because children are growing, so bone marrow can be found everywhere. But as the person ages, the bone marrow is limited to the sternum, to the ribs, to your pelvic bone, to the ends of the humerus and femur. So the ends of your bones of the arm and the bones of your legs. So what is the job of your thymus? Again, thymus is identified as your primary lymphatic organs, as in they are responsible for production and maturation. So in this case, thymus' job is to only and only mature your T cells. Again, remember, T for thymus. Where is it located? It is located right on top of the heart, between the trachea and the sternum. And it is extremely important to note that as the person ages, the thymus starts to shrink. So during the childhood, thymus is extremely active because it's trying to basically develop the immunity in the child. But as the person ages, the thymus gets smaller and smaller, and in adults it's about 5% of its normal structure. So basically in children, you're developing again your immune system, highly active thymus. By the time you reach adulthood, the immune system should already be formed, and therefore there is no major need for thymus. So it is changed to fatty tissue. Now, talking about the lymphatic organs, the other category of lymphatic organs are identified as secondary lymphatic organs, with the main function being storing the white blood cells and basically monitoring to make sure everything is okay. And if they see there is an infection, that's when the whole process gets triggered. So a spleen located on the left-hand side of the abdominal cavity, right next to your stomach. If you look at a sample of the spleen underneath the microscope, as you can see in a picture right there, you will see these patches of white surrounded by this kind of red sea. And these two structures are known as white pulp and red pulp. They have major differences in terms of their function. White pulp is where you, as the name white implies, they are where you can store your white blood cells, basically getting ready to be used, monitoring the fluid and making sure everything's healthy. Your red pulp, on the other hand, is, as the name implies, they're associated with your red blood cells. So as the blood comes into the spleen, any red blood cells that is damaged or is basically old, they go through a spleen picks those up and destroys those red blood cells and allow the healthy red blood cells to continue pass through. Now, you may have heard of this question: can a person live without their spleen? And the answer is yes. So a spleen is one of the lymphatic organs. It's not the only one that does the jobs that are listed. So basically, if you remove the spleen, can a person still function normally? The answer is yes, because you have white blood cells stored in other parts of your body, And in terms of the red pulp, you have your liver and as well as the free white blood cells inside your bloodstream that are going to be able to destroy your old and damaged red blood cells. So yes, the answer again is yes, you can survive just fine without having a spleen. Is it ideal? Of course not, because again, you're putting a strain on other organs. Lymph nodes. So you can see in a picture the location of the concentrated lymph nodes throughout the body. These are literally nodules of lymphatic tissue that are containing two main categories of white blood cells: lymphocytes, which includes B cells and T cells, and macrophages, which are again carrying a process called phagocytosis. Basically means that they are going to engulf any type of infective agents. They literally eat up the pathogens. Now, 500 lymph nodes throughout the body. I didn't write this on the board, on the notes for you, but please do note that some of these lymphatic tissue are more superficial, like under the armpits or around the neck. And some of them are deeper, for instance, in the thoracic region. What is the job of these lymph nodes? They are basically, as the lymph, which is passing through the lymphatic vessels, are being collected, they go through these lymph nodes. Basically, think about them as the stop signs. The lymph nodes look at the lymph, look at the fluid, and make sure that there is no pathogens in that lymphatic fluid or in that lymph. And if there is, they're going to mark them for destruction, or they will destroy them. In another sense, they're actually acting as immune surveillance for your lymph and lymphatic vessels. So a lot of times when people have cancer, especially breast cancer, in many cases, the lymphatic nodes in that region of or in that region also gets removed. Because the lymphatic nodes and lymphatic vessels have been removed, then that tissue becomes more susceptible to fluid retention and edema. Basically, you're removing an effective way of you collecting fluid from that part of the body. So lymphatic nodes are extremely important. It is one of those symptomatic structures, that may mark a person have some sort of infection, or if there is no pain associated with them, they may imply development of cancer cells. Tonsils. Tonsils is the next structure. We already talked about this. This is surrounding your pharynx or your throat. They do mark pathogens that are either entering through your mouth or your nose for destruction. And if there is any sort of pathogen, sometimes you do see inflammation of the tissue of the tonsil as they fight off the infection. Previously, again, it used to be very common that in children when they had inflamed tonsils over and over, they were more, the doctors would recommend tonsillectomy, which basically meant removal of the tonsils. However, that type of surgery have slowly declined, as there may be benefits long-term to keeping the tonsils rather than removing them. Appendix is another one that people may have heard of a lot about. Appendix is, as you can kind of see in a zoom-in picture, is located at the beginning of the large intestine. So this little tiny kind of worm-like extension coming off, that's the appendix. It is contains some good bacteria that helps regenerate the bacteria of the intestine. After somebody has a condition that damages the normal healthy bacteria of the digestive system. It may also play a role in fighting off infection in long term. This is another organ that used to be removed if a person had appendicitis or an inflamed appendix. They used to perform a procedure called appendectomy. However, nowadays, again, that's something else that people are, the type of surgery that is declining nowadays, to basically help with possible benefits of keeping the appendix rather than removing it. Now, I'm going to stop the lecture here. We will continue the lecture looking at the type of immunity, which is categorized as innate and adaptive.